what rehab really is. If your rehabilitation consists mostly of massage, electric muscle stimulation machines, or ultrasound therapy, there is a good chance your real problem is not even being addressed, because most of the musculoskeletal pain is not a medical problem. It is a movement problem. Here is a real-life example. A couple of months ago, I had a client coming for consultation. A lady in her 40s or 50s. Her problem was a low back pain. So we talked about her problems, about her hypothetical causes, and about the ways she tried to treat it. Of course, she went to a doctor. The doctor prescribed massage, break, muscle relaxants. Nothing of this helped. Eventually, she went to a chiropractic clinic. And she started being happy. She said every time after the session, the pain disappeared. So I replied to her, well, that's fantastic. For how long did this treatment help? She said 3 to 4 days. So I asked her, well, then what do you do then? Well, I go again. This is not a treatment. This is a patient who is paying for service. And that's what many rehabilitation therapies offer. You see, doctors are experts in disease, trauma, infection, and serious pathologies. They are essential when something is fractured, torn, inflamed, or medically dangerous. But most everyday musculoskeletal pain does not come from disease. It comes from how the body moves and manages the mechanical load. And this is the domain of biomechanics, not medicine. This is also why many physiotherapy modalities are vastly overused. Electrical muscle stimulations, infrared therapy, ultrasounds, endless passive massage. These treatments can reduce pain temporarily or relax tissue, but they rarely fix the mechanical reason why the problem appeared in the first place. You cannot solve a movement problem while the patient lays still. Frankly speaking, patients themselves are partly responsible for these modalities gaining momentum. Going to a doctor or a physiotherapist, lots of people expect a quick fix, a complicated method or an expensive equipment that will ensure fast recovery. And are happy to undergo these protocols even they are very expensive, while questionably effective. After all, it's the insurance policy covering the costs, while input from the client is rather effortless. It creates impression that the treatment is both easy and effective. Unfortunately, the real lasting progress is never effortless. Real rehabilitation is an active investigation and rebuilding process. We look at joint mobility, muscular strength, coordination, load tolerance, movement patterns, because the body is a mechanical system. If one joint cannot move properly, another joint will compensate. If one muscle cannot stabilize, another structure becomes overloaded. Pain is often the final signal of that imbalance. Real rehabilitation restores the body's ability to move, stabilize, tolerate load, and trust your own capacity. Not with gimmick machines, not with passive treatments, but with structured, intelligent movement and progressive overload. If the problem was created by the movement, the long-term solution must also come from the movement. Pain is often just the alarm system. And that is why real rehabilitation is not passive. It is structured movement that restores the body's ability to handle load again. If you like my content, subscribe and click this notification button. It really helps with the algorithm.